Hello, I am Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, IVF Pune. Today, let us talk about a very interesting topic in IVF, freezing of oocytes. Now, we have seen various types of freezing in our previous videos, but today we are going to discuss about something which is called as social oocyte freezing or social egg freezing. Now what happens is, whenever a couple cannot conceive, they come to us and we make babies out of the eggs from the mother and sperms from the father. However, in this technology, whenever we make embryos, we freeze them, and at a later date we do a frozen embryo transfer, in which we transfer these frozen embryos into the mother. However, there are certain ladies who do not want an immediate pregnancy, but they know that the biological clock is ticking, and for these ladies especially, this is a legal option which is available, which is known as social egg freezing. Now, ladies who are not married or ladies who are married but would want to space their pregnancy after 4-5 years, ladies who are at the brim of their biological clock, for example 34-35 years of age, and who wish to postpone the pregnancy for another 4 to 5 years, we need to understand that the mature eggs in such ladies are going to be exhausted after 4 to 5 years, and she may not conceive with her own eggs if she waits for another 4 to 5 years. For such ladies especially, there is a technology which is known as social egg freezing, in which the patient who wants to freeze her eggs to maintain their biological value at that particular age are subjected to a IVF-like procedure. That is the first part of IVF, in which the patient takes injections for 10 to 12 days, in which both her ovaries are stimulated to produce a large number of eggs and good quality of eggs, after which she undergoes a ovum pickup surgery. During this ovum pickup, her eggs are retrieved through the vagina and the mature eggs are sorted out, that is the M2 eggs. These M2 eggs are then frozen with the help of certain commercially available freezing media by a technology which is known as vitrification. After vitrification is done, these eggs can be stored from 2 years to 5 years or sometimes even 10 years in the IVF center itself. Now, after 4 or 5 years, when the lady thinks of marriage, or when the lady wants to opt for a child, being married now for 4 to 5 years, or certain patients who are delaying their pregnancy because of their career options or because of the education, can then opt for making an embryo out of the frozen eggs even after 5 years of freezing. At that time, her eggs which were frozen at -196 degrees Celsius are then got back to life by a procedure which is known as thawing. That is, the temperature is around 37 degrees, and then the husband's sperm are taken and the embryo can be made. So my friends, whenever a freezing can be done, after thawing you can make a child out of those frozen eggs at any time after 2 years or 5 years or even a decade after freezing these oocytes. Now the million-dollar question, are these oocytes harmed by the technology? And the answer is a big no. We understand that there are so many places on earth in which there is complete snow and there is flora and fauna and life very much below the snow, and once the snow melts, everything and the nature also gets back to normal. So in these oocytes also, the DNA or the microstructure of the egg is not at all harmed, and it is only the eggs are stored at -196 degrees, and then when they are thawed, they are got back to life, and the babies resulting out of these stored eggs or frozen eggs are as normal as any other naturally conceived child. Thank you.